Okay, here we are. We're going to do 32 needle injections in this handsome man's face. Andrew is a patient. How do you feel about needles?
Well, 32 shots into my face, not very good.
Yeah.
Not very good, Doc.
I think that's a normal reaction for most people.
Yeah, no doubt. I know that the benefits are there, but it definitely gives me anxiety every time I think about it.
So that's normal. What we're going to do right now is we're going to teach you belly breathing, humming, and we're going to inject only on the exhalation.
Absolutely.
Okay, so one hand on the belly, please, the other on the chest. And really quickly, the goal is to breathe with the belly and not the chest. There you go, that's really good. That's diaphragmatic breathing. Often people in yoga can do this as well. If we start breathing from the chest, bad. Okay, that's fear, fight or flight response. It's shallow, and in the worst case, holding your breath. Oftentimes patients will hold their breath while getting the injection, and sometimes they pass out. So what's the solution? Well, breathe with the belly, activate your parasympathetic response, which is calming. We use this to eat, to fall asleep. And if we can do this during the injection, it's so much more comfortable.
Well, I'm willing to try just about anything.
You got it.
32 needle points to the face. Let's
Woo!
do this.
Let's see this. All right, let's do this. Let's start over here. We're going to start with the masseters. And I'm breathing with him. Clenching the teeth as strong as you can. Clench, clench, clench. 1, 2. Keep clenching. That's 3.
You know, that's amazing. I really, really feel a difference.
Now we're going to add the humming. Okay? Clench, clench, clench. Exhale and hum.
I feel like I don't want to stop. I did not feel the needle.
Isn't that interesting? That's what the patients report.
I want to keep going with that.
Wow, that is amazing. Okay. Let's now go into the temple area. This is for people with TMJ and headaches, okay? And hum. I lost count. I think there was 12 to 14.
I have to tell you, Doc, I have to tell you, we have done this before for my TMJ, and that is always the scariest and most painful part, without question. The breathing and the humming, it's amazing.
Wow.
It's amazing. It's amazing.
We're onto something.
Well, I didn't know this was going to happen today. I did not. And I'm very, very impressed. This is really neat.
Humming. Excellent. Now notice, it's very simple. We can teach all healthcare professionals this. Empathic awareness, see how the patient's doing. If they look anxious or they're breath holding, teach them to breathe.
Doctor, it seems to be as important for me to close my eyes while I do this. It gives me more of a focus. Is that something you're finding?
Yes. Now, I'm so glad you brought that up.
It helps me focus on the breath and the humming, and it takes other sensories out.
What we're going to do now is level up. We're now going to release oxytocin and serotonin during the injection. How will we know? If he starts smiling during the injection. That would be amazing to see somebody smile while getting an injection. Okay?
Especially me, I don't like needles.
Okay. Think about your son when he was an infant and you were sleeping with him. Smiling. Is he sleeping on your chest or to your side? On the chest. Excellent. hum the sound that you're feeling as you're holding him and sleeping with him. Let's now activate the frontal cortex. Give me 3 adjectives to describe the feeling as you're sleeping with him.
Warm, safe, beautiful smell. Oh, so precious, so young, innocent.
I love it. Look,
Joyful. Ah, Mason.
That's right.
Oh my gosh. Yeah.
Hey, we're finished.